Well, knowing the devastation COVID-19 has had across the world, catching the virus is a big fear for many. Leaders everywhere are doing what they can to protect their communities and reduce the spread while also trying to find a way to lift restrictions and get people back to work. Some are looking to antibody testing for help. Morella Porter joining us live. Morella, local doctors warn it could be too early to rely on antibody testing for answers.
Yeah, that's right, Michael. Dr. Karen Landers tells me COVID-19 antibody testing is largely unproven. So when it comes to the results,
around the country, antibody testing is being used to determine if someone has recovered from COVID-19, even if they never showed symptoms. In Mobile, hundreds of first responders, healthcare workers, and public works employees across the city have been tested for COVID-19 antibodies over the last few weeks. Mayor Sandy Simpson said they were using the data to help people safely return to work. In other states like Indiana, large-scale random antibody testing is being done. Leaders there say they will take the testing into consideration as they work on lifting restrictions. Of the dozens of COVID-19 antibody tests on the market, only 7 have been authorized by the FDA. Dr. Jason Harrison with the Diagnostic and Medical Center in Mobile says the quality of those tests varies greatly. Dr. Karen Landers with ADPH believes more information is needed before we start promoting widespread antibody testing.
I think it's very early to be really looking at this as a tool for that because we do not have good data, again, to indicate whether or not this is really an effective test. Even if it is effective, how protective is a positive antibody for any length of time?
Experts with the World Health Organization say there's not enough evidence to prove that people who have recovered from COVID-19 or tested positive for antibodies are immune from catching it again.
And the concern is, as we look at the scientific data so far, is that we're really not certain of the accuracy of these tests, but more importantly, we don't know that even if a person tests positive for COVID-19, does that really mean that they are going to have immunity even immediately or for any length of time or lifelong?
and Dr. Landers says at this point we should assume reinfection is possible. And she says that people who have recovered from COVID-19 or have tested positive for COVID-19 antibodies should still social distance and take precautions. Live in Mobile, Morella Porter, Fox 10 News.